Imagine taking this widely celebrated all-natural supplement to, heal a really painful skin condition.
Right.
But then you find out you are inadvertently giving that disease a totally free pass to cause irreversible tissue damage.
Yeah, and potentially poisoning your liver in the process.
Exactly. Today, we're looking at this massive collision course between the wellness world's absolute favorite golden spice and a severe chronic autoimmune condition.
Because for you, the listener who's navigating this specific diagnosis, the stakes, I mean, they really couldn't be higher.
They couldn't. We are tackling a highly tailored mission today. Can turmeric supplements actually help with lichen sclerosus?
It's such a huge question right now.
It is, and to get you the definitive answer, we've pulled together an incredible stack of sources. We have clinical guidelines from the British Society for the Study of Vulval Disease.
And patient guides from the NHS, plus the Women's Health Clinic.
Yeah, and a really eye-opening toxicological report from the UK government's Committee on Toxicity, some cardiac advice from the British Heart Foundation, and a super dense dermatological review from Dove Medical Press.
It's a phenomenal cross-section of data, honestly. We're basically pulling threads from dermatology, toxicology, and cardiology to build a complete picture.
Because when you're dealing with a localized autoimmune condition, the systemic treatments that get heavily promoted by internet wellness communities, they often fail to translate into actual clinical results. Okay, let's unpack this.
Let's do it.
Since you, the listener, are already following this topic, we're going to spend time listing the basic symptoms, right? You already know about the intense nocturnal itching.
And the fragile, tearing skin. Yeah, that's the daily reality.
Exactly. But to understand why certain interventions fail spectacularly while others work, we really need to look under the hood. So what is actually happening at a cellular level when someone has lichen sclerosus?
Well, the best way to understand the pathology here is to look at the basement membrane zone.
The basement membrane.
Yeah, it's this critical junction where your epidermis, which is the outer layer of skin, meets the dermis underneath.
Okay, got it.
So in lichen sclerosus, your immune system's T cells essentially launch this unprovoked attack on the proteins and structural components of that specific zone. It causes what we call a profound inflammatory infiltrate.
I was trying to visualize this when I was reading the sources, and the analogy I kept landing on is like a high-end home security system that has completely malfunctioned.
Oh, that's a really good way to put it.
Right, like it has locked you out, and now the security drones are inside, aggressively dismantling the structural load-bearing walls of your own house.
That is highly accurate, actually, because it isn't just a surface-level irritation, it is a structural demolition.
Wow.
Yeah, the chronic inflammation leads to this overproduction of abnormal collagen, and that's why the skin becomes atrophic or thinned out on the surface, but deeply scarred and thickened underneath.
And if you just allow that internal demolition to continue unabated, the anatomical consequences are pretty severe.
Oh, they're life-altering. The sources outline those stakes very clearly. Untreated, the persistent scarring leads to anatomical fusion.
Which means what exactly for the patient?
Well, in women, this means the literal flattening or complete loss of the labia minora and the narrowing of the vaginal opening.
Right, and for men, because they get this too.
They do, yeah. It's frequently called balanitis erotica obliterans in men, and it leads to the fusing and severe narrowing of the foreskin.
Which turns basic human functions like, urination and sexual intimacy into incredibly painful ordeals.
Exactly. But beyond the immediate anatomical destruction, there's an even more critical stake here, and that's cellular mutation.
Because of all the inflammation.
Yes. That relentless, unchecked inflammatory environment basically creates a breeding ground for cellular errors. There is a documented statistically significant risk.
Like it's about 1 in 20 for women with vulval LS, right?
Yes, exactly, 1 in 20. A risk of developing squamous cell carcinoma, which is a serious form of skin cancer, directly on the affected areas.
So if the core mechanism driving all of this destruction is rampant autoimmune inflammation, I can completely understand why a patient would start looking at natural, highly publicized anti-inflammatories.
Oh, absolutely. It's human nature to look for a natural fix.
You do a quick search, and suddenly turmeric is being pushed as the ultimate natural cavalry coming to save the day.
And the wellness marketing around turmeric, and specifically its active polyphenol compound curcumin, is incredibly persuasive.
It really is.
And I mean, to be fair to those marketing claims, they are drawing on actual documented science.
Yeah, the Dove Medical Press review we looked at is a perfect example of that. I was reading through the dermatological resume of curcumin, and on paper, It looks like a targeted weapon against immune misfires.
It really does.
Yeah.
Because it doesn't just broadly reduce swelling, it actively suppresses specific inflammatory cytokines.
Cytokines, those are the chemical alarm bells of the immune system, right?
Exactly. When the body perceives a threat, it releases these messenger proteins to recruit white blood cells and trigger that inflammatory response.
And curcumin stalks that.
Well, it's been shown in vitro to intercept several major alarm pathways. We're talking tumor necrosis factor alpha, interleukin-1, and the highly complex IL-6 state 3 signaling pathway.
The clinical results for other conditions are honestly impressive. The review details how curcumin successfully mitigates atopic dermatitis.
Right, eczema.
Yeah, and it visibly reduces the lesions in plaque psoriasis. It even accelerates the healing of chronic wounds by promoting fibroblast migration.
Which basically means it actively helps new skin cells move in and rebuild damaged tissue. The data on curcumin for epidermal hyperproliferation conditions like psoriasis is really robust.
Psoriasis is the one with the rapid skin turnover, right?
Yeah, psoriasis involves a very rapid turnover of skin cells driven by a systemic inflammatory loop, which curcumin can slightly modulate.
I am genuinely stuck here then. Because if the Dove Medical Review proves curcumin fundamentally shuts down these aggressive inflammatory cytokines, and LS is caused by an aggressive inflammatory response. Biologically, why doesn't this translate to a cure for lichen sclerosus? Why can't we just use this natural compound to turn off that malfunctioning security system?
That is the million-dollar question. And it comes down to the profound difference between systemic circulation and localized barrier penetration.
Okay, break that down for me.
So curcumin, taken orally, is a systemic agent. It goes through your whole body. But lichen sclerosus is a highly localized, deeply entrenched dermal scarring process. The biological barrier is the main issue.
Meaning the curcumin you swallow simply cannot reach the actual battleground in the genital skin in high enough concentrations to stop the T cells.
Precisely. It just can't get there. And this is the stark reality outlined in the clinical guidelines from both the Women's Health Clinic and the expert notes from practitioners like Dr. Jolene Brighton.
What does it say?
They are unanimous. There is absolutely no reliable, peer-reviewed clinical evidence that oral turmeric supplements can treat, arrest, or cure lichen sclerosus.
Wow. Zero evidence. It seems like a classic case of confusing general systemic support with a targeted heavy-duty intervention.
That's exactly what it is.
Like swallowing a turmeric capsule might lower some background oxidative stress in your body, sure. But trying to stop the deep structural immune destruction of LS with a dietary supplement is like
standing on the sidewalk and yelling at your malfunctioning home security panel.
Yes. It simply doesn't have the access or the authorization to shut the system down.
And that lack of access is dangerous when patients use supplements as a substitution strategy.
The opportunity cost.
Right. The greatest risk highlighted by the clinical guides isn't that turmeric is inherently poisonous on its own, it's the time you lose. When a patient opts for an unproven natural remedy instead of evidence-based medicine, they give the disease weeks, months, or even years to quietly continue its structural demolition.
And by the time they realize the turmeric isn't working, the scarring and the fusion, it's permanent.
It is. You can't reverse the anatomical changes once they happen.
But let's look at a different scenario, just to be thorough. Let's say someone is fully compliant. They understand turmeric won't cure their LS, but they are taking their prescribed evidence-based medication.
Okay, so they're using the right treatments.
Yeah. What is the harm in adding a high-dose turmeric capsule to their morning routine, just as an adjunct? Like a little extra systemic anti-inflammatory power seems like a harmless safety net, right?
You'd think so, but that assumption of harmlessness is where the wellness industry does a massive disservice to consumers.
Here's where it gets really interesting.
Adding high-dose engineered turmeric supplements is not a risk-free, free roll. When we examine the toxicological report from the UK government's Committee on Toxicity, the biological reality of these supplements is, frankly, quite alarming.
The bioavailability problem, right? I found that fascinating. Because natural curcumin, the way you find it in just turmeric root or basic curry powder, has absolutely abysmal bioavailability.
It really does. If you eat it, your gut and liver essentially recognize it as a foreign substance to be cleared out.
Like a toxin.
Basically, yes. And they process it out of your body incredibly quickly. Barely any of it reaches your bloodstream. The human body is just very efficient at maintaining homeostasis. It naturally limits the uptake of these polyphenols.
But supplement manufacturers are well aware of this metabolic roadblock.
Oh, they definitely are. To create a product that actually elevates curcumin levels in the blood, they have to engineer biological workarounds.
They create those synthetic liposomal forms. Or, most commonly, they add absorption enhancers like piperine, which is literally just an extract of black pepper.
Exactly, piperine.
And this is where the mechanism gets incredibly sketchy to me.
Yeah.
How does black pepper actually force the body to absorb something it actively wants to reject?
Well, piperine doesn't just gently usher curcumin across the gut lining. It actively inhibits two major metabolic pathways in the liver.
Wait, what? It inhibits liver pathways. Which ones?
The UGTs and CYP450 enzymes. These are the very enzymes responsible for a process called glucuronidation.
Glucuronidation. Okay, that's a big word. What does that actually do?
It's how your liver attaches water-soluble molecules to toxins and drugs so you can urinate them out. It's your main detox system. And piperine essentially paralyzes this natural detox pathway.
Oh, wow. So by shutting down the liver's primary exhaust pipe, the curcumin is forced to stay trapped in the bloodstream.
Yes.
But that must mean everything else the liver's trying to clear gets backed up too, right?
That is exactly what happens. You are chemically handcuffing your liver's primary defense mechanism.
That sounds incredibly dangerous.
It is. This forced absorption biohack comes with severe consequences. The Committee on Toxicity report details rare but serious cases of idiosyncratic liver damage and hepatitis directly linked to these enhanced turmeric supplements.
Idiosyncratic meaning what in this context?
It means it is highly unpredictable. It's based on your specific genetic metabolic rate. So a dose that seems totally fine for one person could send another person's liver into acute failure simply because their specific enzyme pathways are being overwhelmed.
And the sheer volume of the dose is also a massive red flag here. I was looking at the toxicological data, and it establishes an acceptable daily intake, or ADI, for curcumin based on body weight.
Right, the safety limit.
Yeah, and it is strictly set at 0 to 3 milligrams per kilogram. So for an average adult weighing 70 kilograms, your absolute maximum safe intake is just 210 milligrams a day.
Yet, if you walk into literally any health food store, the trendy enhanced turmeric supplements on the shelf routinely pack 500, 1,000, or even 1,500 milligrams into a single daily serving.
That's insane. Consumers are unknowingly blasting past safe toxicological limits by 500 or 600% every single morning.
And the liver toxicity isn't even the only risk profile.
You're talking about the cardiac warning.
Yes. The British Heart Foundation issued explicit warnings regarding major drug interactions, specifically because high-dose curcumin acts as a potent natural anticoagulant.
It thins the blood.
Heavily, and this is a critical warning for anyone managing multiple health conditions. If you are taking a prescribed blood thinner, like warfarin or any of the newer DOACs for stroke prevention or atrial fibrillation,
Adding a high-dose turmeric supplement compounds that affect exponentially.
exponentially, yes. Because remember, the piperine is also paralyzing the liver enzymes that are supposed to process that medication.
So the anticoagulant just builds up in your system.
Exactly, creating a profound risk for an uncontrolled, potentially fatal internal hemorrhage.
Add in the fact that high-dose curcumin stimulates excess bile production, which leads to severe gastrointestinal distress, cramping and diarrhea.
Yeah.
It really shatters the illusion of a harmless natural wellness hack.
It really does. It behaves much more like an unregulated pharmaceutical drug with wildly unpredictable side effects.
Which brings us back to the core problem for our listeners. If oral supplements cannot penetrate the skin barrier to stop the autoimmune attack, and attempting to force them into the bloodstream risks liver toxicity and hemorrhage, what is the actual scientifically validated mechanism to stop lichen sclerosus?
The absolute gold standard, universally mandated by both the BSSVD clinical guidelines and the NHS, is the use of ultra-potent topical corticosteroids.
Specifically a formulation like clobetasol propane at 0.05%, right?
Yes, and we really must emphasize the prefix ultra-potent.
Because many patients try to self-medicate with over-the-counter 1% hydrocortisone creams. They just assume, a steroid is a steroid.
Right, but the pharmacokinetics just don't support that.
Go back to our home security analogy. Using mild hydrocortisone is like knocking on the front door and asking the rogue drones to please quiet down. It just lacks the chemical authority.
Exactly.
So how does an ultra-potent steroid like clobetasol actually succeed where other anti-inflammatories fail?
Well, it succeeds through deep, localized penetration and basically cellular hijacking.
Cellular hijacking. I like the sound of that.
Clobetasol propionate is specifically formulated to forcefully cross the stratum corneum, which is the tough outer layer of skin, and penetrate deep into the dermis where those T cells are actively attacking the basement membrane.
And once it gets down there?
Once there, glucocorticoids literally cross the cell membranes of the immune cells. They enter the nucleus and they bind to the DNA.
Wow, so go straight to the source code.
Yes, they act as a master code, manually turning off the specific genes responsible for producing those inflammatory cytokines, while simultaneously turning on genes that produce anti-inflammatory proteins.
It is a complete localized shutdown of the malfunctioning security system. But I noticed the clinical guidelines are also incredibly specific about the vehicle carrying that master code. They strongly mandate using steroid ointments rather than creams.
They do.
I found the chemistry behind that distinction fascinating. Why does the base formulation matter so much to the outcome?
It's really a matter of minimizing secondary trauma to an already devastated skin barrier. Creams, by definition, are emulsions that contain a significant amount of water.
And water breeds bacteria.
Exactly. Because of that, pharmaceutical manufacturers must add a cocktail of harsh preservatives, alcohols, and stabilizing chemicals just to give the cream a shelf life.
And when you apply a cocktail of alcohols and preservatives to genital skin that is already atrophic, torn, and actively inflamed by lichen sclerosus, that has to cause an intense burning pain.
Oh, it's excruciating for many patients. But not only does it burn, that damaged epidermal barrier makes the patient highly susceptible to developing a secondary contact allergy to those very preservatives.
So treating it could actually make the condition exponentially worse if you use a cream.
Yes. Ointments, conversely, are anhydrous. That means they contain little to no water.
So no water means no need for the harsh preservatives.
Precisely. The greasy, petroleum-like base provides an immediate, soothing, protective barrier over the fragile tissue. It locks in moisture and delivers the active clobetasol deeply and comfortably.
However, the moment you mention ultrapotent steroids, a very understandable fear arises for a lot of people. Patients read the warning labels about steroid-induced skin atrophy.
The thinning of the skin, yes.
Given that LS already causes the skin to thin out and tear naturally, applying a medication known to thin the skin sounds counterintuitive. Honestly, it sounds a little dangerous. How do dermatologists reconcile that risk?
The fear of skin atrophy is entirely valid. I want to be clear about that. But it is a risk associated with chronic, continuous, unmanaged application.
Unmanaged being the key word.
Right. The clinical reality for LS is managed through a highly precise, mathematically structured tapering regimen. The goal is to aggressively suppress the immune response and then systematically back off to allow the skin's cellular life cycle to regenerate.
The induction phase of that regimen is very strict from what I read. The guidelines define a precise measurement, the fingertip unit.
Yes, the FTU.
Which is literally a line of ointment squeezed from the tip of the adult index finger to the first crease. And that equals exactly 0.5 grams of medication.
That 0.5 gram dose is applied to the affected areas once daily for exactly 1 month.
Just 1 month of daily use.
Just 1 month. This is the heavy induction phase to put the fire out. During the second month, the dosage frequency is cut in half. It's applied only on alternate days.
And then by the third month?
By the third month, the patient steps down to a twice-weekly application.
That tapering seems crucial. You aren't constantly bombarding the tissue.
Exactly. The human epidermis takes roughly 28 days to fully turn over and regenerate. So by stepping down the frequency, you maintain enough local immune suppression to keep the T cells dormant.
But you give the epidermal stem cells the physiological breathing room they need to actually rebuild the skin barrier.
You hit the nail on the head. The sources are definitive on this. When a patient strictly follows this twice-weekly maintenance regimen, the risk of steroid-induced atrophy is incredibly rare.
And the benefits, on the other hand, are pretty much life-altering.
Huh.
The regular long-term use of clobetasol successfully halts the irreversible scarring, right?
It does. It prevents further anatomical fusion and drastically reduces the inflammatory environment that drives that 1 in 20 risk of developing squamous cell carcinoma.
So it's basically the only empirically proven method to protect the structural integrity of the tissue and preserve the patient's quality of life.
Yes, without a doubt.
So what does this all mean for you? If we synthesize everything we've uncovered from this massive stack of sources, the directive for you, the listener, is really unambiguous.
Very unambiguous.
While the wellness industry brilliantly markets turmeric as this golden panacea, the clinical reality is starkly different. There is zero evidence that systemic curcumin can halt the localized autoimmune destruction of lichen sclerosus.
None. And relying on it as a primary treatment just gives a destructive disease the time it needs to cause permanent anatomical damage.
Furthermore, the biohacked high-dose supplements on the market pose a legitimate, unpredictable threat to your liver's detox pathways, and they can trigger truly dangerous interactions with cardiovascular medications.
Yeah, it's not worth the risk.
Not at all. The true defense against this condition is a disciplined, ongoing regimen of ultra-potent topical steroid ointments.
That is the medical reality today.
Well,
But, the scientific landscape is never static, and the clinical guidelines do point towards some highly compelling research currently in the pipeline.
yeah, the sources mentioned the Pearl-S trial, which is actively working to define the absolute minimum effective dose for long-term steroid maintenance, trying to refine that safety profile even further,
They are, but they're also looking beyond steroids entirely.
which is super exciting.
That is where the future gets truly interesting. Dermatological researchers are actively running trials on topical JAK inhibitors.
JAK inhibitors.
Yeah, they represent a completely different class of immune-modulating drugs. They basically intercept the inflammatory signals at a completely different cellular checkpoint. This potentially bypasses the mechanisms that cause skin thinning altogether.
Oh, wow. That would be huge.
And they are also exploring regenerative therapies, like injecting platelet-rich plasma.
PRP, like what they use for sports injuries.
Exactly, harvested right from the patient's own blood to actively stimulate the repair of that scarred dermal layer.
It really leaves us with a fascinating, provocative question to consider. Because steroid ointments are the undisputed champions right now, right?
Yeah.
They're the only proven way to turn off that malfunctioning security system.
For now, yes.
But as we map the precise genetic and molecular pathways of lichen sclerosus, how close are we to a medical breakthrough where we can finally reprogram the immune system at its source, rendering even our most potent topical steroids completely obsolete?
It's a horizon worth watching. But until then, trust the proven science, work closely with your specialist, and protect your long-term health.